All right, so it's about noon and we will begin. Welcome to the Canadian Public Health Association's Infectious Disease and Climate Change webinar series. It's so nice to see so many of you joining us today as we kick off the fall 2022 edition of our series, where we will be exploring the current and emerging infectious disease and climate change topics to share knowledge, research, and best practice. Before we begin, we want to acknowledge that the Canadian Public Health Association's offices is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for a millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, Métis, and Métis peoples and their governments in realizing meaningful truth and reconciliation. Today's webinar, Companion Animal Surveillance, How Can Our Companions Contribute to Public Health, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. My name is Maddie Schuler. I'm a project officer with CPHA, and I will be moderating today's webinar. Before we begin, I wanted to take a quick minute to let you all know about some other infectious disease and climate change resources. You can find these as well as more information about them on our website at cpha.ca. So we recently added new resources to this section. It holds a compilation of the most recent research, reports, tools, and other evidence-based information regarding infectious disease and climate change in Canada, and is updated routinely. So we strongly encourage you to check that out. A couple quick notes before we begin. I know we're all far too familiar with Zoom at this point, but if you do have any questions for our presenters today or technical difficulties, please type them into the Q&A box at the bottom of your screen. After the presentation, I will read out the questions and our presenter will answer them. We do strongly encourage attendee participation and look forward to hearing your thoughts and questions today. Secondly, our webinar is being recorded and will be made available on CPHA's YouTube channel a couple days after the presentation, and presentation slides will be shared as well. Lastly, we would love to get your feedback, so after the webinar, please fill out our 5-minute survey, which will open automatically in your browser once you close Zoom. The feedback is really appreciated, and it does help to make these webinars what they are. So without further ado, I would like to introduce our speaker for today's webinar, Dr. Tasha Epp. Dr. Epp's research interests are on the epidemiology of zoonotic diseases. Her PhD work, which focused on the epidemiology of West Nile virus in Saskatchewan horses, later evolved to assist with the surveillance and assessing prevention methods for West Nile virus in Saskatchewan. Dr. Epp's current research interests focus on the epidemiology of zoonotic diseases of companion animals, particularly as it regards to northern, rural, remote, or First Nations communities. Dr. Epp led an extensive scoping review that assessed evidence for the risks for dog bites, health-related impacts of dog bites and dog bite prevention, or dog population management effects on the occurrence of dog bites. As part of the project, the team has developed the Community Dog Workbook based on years of experience and discussions with many communities struggling with dog populations or dog-related issues. She is also the lead for development and implementation of a companion animal surveillance initiative for Western Canada and the development of the Pet Atlas for Western Canada. And with that, I would like to turn it over to Dr. Epp.
Perfect. We will try to make this sharing work. Okay, just a second. Okay. So thanks for having me chat with you guys today. So I am a veterinarian and an epidemiologist, and probably one of few people across Canada who from an epi perspective is looking at companion animals. So I'll talk to you a little bit about both sort of focuses on dogs, so dog health, but how that might contribute from a public health perspective. So to start with, we certainly have examples where animal health contributes to public health, particularly on our livestock side. So for example, if we were to look at something like avian influenza, most people would be familiar with the Public Health Agency and provincial ministries of health looking at influenza overall and looking from the perspective of how does avian influenza or sometimes swine influenza impact impact that. On the animal health side, we have federal government from the Canadian Food Inspection Agency involved, all the provincial ministries of agriculture, the poultry industry. That's all on the livestock side. So we know when and where and what to do about outbreaks in our poultry industry. But we also have the Canadian Cooperative Wildlife Health Centre that looks after doing the duck surveys every year, looking at what's in our wildlife population, as well as understanding if there's impacts on songbirds and other stuff, as we've seen this year. Certainly, this is something that's well established. There are other livestock diseases for where this happens as well. Some of these are zoonotic, some of them just have trade implications, but there is a system and a network for this, and it's well established. Same cannot be said for our companion animals. At present, really the only surveillance we have for companion animal disease on a Canada-wide basis is rabies. And that's a very good system, was recently sort of downgraded from an animal health perspective to the provincial level, but it's still ongoing and every province does do this. And certainly does contribute to public health. That's kind of an obvious one. But outside of that, there is no standardized ongoing Canada-wide companion animal surveillance. One example that we have that's a regional is the Ontario Animal Health Network, which is essentially a network of networks. And so there is a companion animal network within that. It has been probably going now for 5 to 10 years. They do what they would call clinical snapshots. So it's essentially a syndromic type of surveillance. They use veterinary and veterinary clinics to give them a snapshot of what's happening for respiratory conditions as a whole or gastrointestinal conditions as a whole. And so it tells us, are there things going up or down? Is there potential for some new pathogen? We can't tell that from a syndromic system, but we know if there's an increased amount of respiratory conditions, for example. So that's the Ontario Animal Health Network. There are certainly research networks also. So the Canadian Lyme Disease Research Network, focusing on ticks and tick-borne diseases, particular Lyme disease. So there's great examples of sharing information in both of these types of networks. So a lot of work done on the animal health side, but that's also communicated with public health. And there have been numerous PhD theses over the years looking at how animal health may be of importance or provide important information for public health. One good example was by a lady named Michelle Anholt, University of Calgary. She did her PhD looking at GI syndromes, specifically salmonellosis, for example, in animals, and would that be maybe an early warning system or a contributor to understanding what's going on risk-wise for public health. From her thesis, she certainly had some interesting sort of comments that came out from it. Animals can provide important information under certain circumstances. They may not actually be early warning. Sometimes they're at the same time as health risks for people. Essentially, our companions live, eat, sleep, play with us. So they're right in where we are. But there are barriers to creating these surveillance systems, and there are certainly some things that work here in Canada and some things that might not. And so one of the ones that she looked at was electronic data capture. This has certainly been used in other places around the world. So this is an example. It's probably the gold standard in terms of animal health surveillance on a companion level. It exists in the UK, and it is basically a real-time capture of electronic data from laboratories as well as veterinary practices. And so it all feeds into one single database. This is possible because veterinarian and veterinary clinics in the UK highly use an electronic data capture of information in their vet clinics. The same cannot be said for Western Canada. In particular, most clinics here still use paper-based, and they use the electronic system mainly for billing. So unfortunately, it doesn't work well to implement an electronic data capture system the same way it might in other countries, because we just don't have the veterinary usage of that system here. So certainly something we need to think about as we decide how we're going to create a system. But I guess the first thing to ask would be, why should we care, right? Dogs, that's veterinary medicine. Why does public health need to care about that? And so certainly I think, if we look at why we do surveillance, we might want to identify threats, health threats. That's important both from an animal health perspective, but in the case of zoonotic pathogens, it could be helpful from a public health perspective. If we're seeing something in dogs, that might give us an indication of what the risk might be for people. It also allows us to respond. There might be targeted groups that we need to correspond with, targeted regions, and that might be implemented on an animal health level, but it could also be implemented on a public health level. And certainly it helps us to understand what kind of programs need to be in place. So when we find rabies in an animal, we know that that's going to be a risk for people. Similar things can exist when it comes to other zoonotic pathogens. Question might be, does this only apply to diseases for which are zoonotic from animals? And the answer to that actually is no. So this is an example of a surveillance system that exists in Los Angeles County. They have a system set up where veterinarians will report cases of a dog-specific pathogen called Canine Parvovirus. So it's a gastrointestinal virus, can cause some pretty severe disease, but it is vaccine preventable. So we have a vaccine, and most dogs can get that when they're puppies and then continue throughout their life, and you won't see disease. Where Los Angeles County uses this is, if you see parvovirus, it's likely in an unvaccinated population of dogs. And so this may be an indication of reduced access to or reduced utilization of veterinary services. And what they also feel is that this might actually then also give them a window into a risk of exposure to zoonotic pathogens that might be more likely in these regions where access or utilization of veterinary services does not exist. So in this sense, it's an indirect usage of a dog-specific pathogen to give them a potential of risk for a zoonotic pathogen. So based on sort of the concept that animals might provide useful information on a companion animal perspective, I mean, these are animals that live with us. They sometimes eat the same food as us. We often sleep in the same bed. So they can possibly be a window into what's happening in people. We wanted to develop a surveillance initiative. Again, we use principles that are useful for developing surveillance, implementing surveillance, and evaluating surveillance, which it doesn't matter if you're looking at it from a public health or an animal health perspective, the same principles do apply. And so in creating our Western Canadian Animal Health Surveillance Initiative, we looked at the framework. So, how would you actually do that? What kind of timeline for collecting information? How would you collect it? In the end, creating a baseline of information, how many years you have to collect that to create that adequate baseline is important to think about. But then we can look at what kind of trends. Are we seeing an increase in the reporting of certain diseases over time? Are we seeing pockets of disease in certain regions and not in others? And this can help in terms of creating infographics for either animal health or public health practitioners. It can help in creating disease alerts, including the information in communications to people. It can also help if we need to respond to detected outbreaks or unusual occurrences of disease. And like all surveillance, it is iterative and it allows reevaluation, changes if those changes need to be made. So this was the system that we used when creating and thinking about the Companion Animal Surveillance Initiative, specifically for Western Canada. I should say this initiative was funded from the Public Health Agency's Infectious Disease and Climate Change Fund. And sort of the usefulness is both on the animal health and the public health side. So a benefit for both. So I'd like to sort of take you through the process of the development. Certainly we needed to think about, what kind of pathogens we were going to follow, what were the case definitions for those, and data collection methods. But then we'll work our way through the other steps in this presentation. Much of the work that was done here was a master's student that I had at the time, Erica Sims, who now actually works for the Ministry of Agriculture in Saskatchewan. So the first thing we needed to do was actually decide what kind of pathogens. So we were focused in on deciding on a select few of zoonotic pathogens that we might follow for dogs. Now we could have just easily gone and said, well, these are some of the ones that come up in the literature, but we wanted to be very systematic about it. And so there was a classic paper written in 2001, the Taylor et al. Paper. If you've ever heard the quote that 2/3 of human pathogens are zoonotic, that's where it comes from. We wanted to follow a similar process, but just using dogs and dog diseases as our starting point. So we started by creating an initial list. We went to textbooks and other publications, really just to create this list of diseases that have been identified or pathogens that have been identified in canines or dogs. And again, we specifically focused in on dogs for this initiative, as it's much easier to create one for one specific species rather than multiple species at once. So we did identify 594 pathogens, and then we needed a systematic approach to basically wheedle that down to a more manageable number. And so our first step was to identify, were they zoonotic? And some people can use that term very broadly. It's a pathogen that's shared between animals and people. You may read that some people will use the term reverse zoonoses, or sometimes that's called anthropoonotic. Sometimes it's included in zoonotic. So kind of wanted to be very broad in that term. As well, we also needed to think about those pathogens for which there was an environmental reservoir and both people and animals could be exposed, and that's sapronotic. So we used a very broad terminology in that first step. Our next step was to think about, how was the dog involved? If it's a zoonotic pathogen and the dog actually isn't involved in any way, it's not useful to monitor dogs. So was it involved in transmission, maintenance of the pathogen, or could it just be very useful from a detection perspective? And then the third step was to just find out whether it actually existed in Canada. Kind of useless to try to surveil something that doesn't actually occur in Canada. And so we were wheedling down the list through this stepwise process. So of those initial canine pathogens, about 82% of them ended up in the sapronotic, zoonotic, anthropoonotic, which is actually a bit higher. So the human side, they suggest 2/3 of pathogens fit into this. So from a dog perspective, there's quite a lot more. But then if we take that and we say, well, yeah, but how many of them actually involve the dog in a significant way? And only about 50% of those 486 pathogens actually have involved the dog and would be useful to use in a surveillance system. There were a couple of pathogens which we called gray zone. And the reason we put them there is there wasn't quite enough evidence to rule out the dog, but also to rule in the dog in the usefulness. So they're ones that we can watch in the future. Maybe there'll be some research or further information on those. And then the pathogen, does it actually exist in Canada currently, particularly in the dog? Or is it something that is completely foreign, is not even likely to occur in Canada? And so we had a sort of a tier system to put pathogens into that list. And so we were focused in on that tier 1, pathogens that exist in the dog in Canada and are zoonotic. Again, if you are interested, it's a bit small, but the list of pathogens includes bacteria, helminths, protozoa, rickettsia. We did actually also include ectoparasites, which there is a bit of controversy onto whether they should be classified as zoonotic. But we took that in a broad meaning that if the parasite itself created a disease condition or syndromic condition in a person, then that should be included. So scabies or psychoptic scabies varcanus was one that was included there for sure. Rabies is on the list, although it was not included as we went further because there already is a surveillance system in Canada. And the fungi are important on this list because they usually fall into that sapronotic category. They often have an environmental reservoir, and people and animals can be exposed through that environmental reservoir. So anyone living in BC will know that Cryptococcus gattii, for example, is a classic sapronotic pathogen. Not considered to be zoonotic, but certainly there's potential for both humans and animals to show clinical disease from that pathogen. And if you are interested in sort of looking at the full list and all of the sort of various tiers that we created through this work, it is publicly available. It was published in the Canadian Veterinary Journal, but the lists themselves, the appendices, they're available publicly on my research website. Now, 84 pathogens is a lot, not something we can incorporate right off the bat into a surveillance system. We were able to condense that down to 51 pathogen groups. So if, for example, Echinococcus, there are 2 strains. Salmonella, there were multiple strains. So those were condensed down. We took those 51 pathogen groups and through an expert elicitation from both veterinary medicine and public health fields, we were trying to narrow that down to perhaps the top 3 to 5 pathogen groups of interest. So through the scoring mechanism, we were able to identify that people put Echinococcus on top of the list. And certainly in the media, particularly in Alberta, Echinococcus has been of importance. Next on the list, we lumped actually the methicillin resistant, so the pink ones there, Staph aureus, Staph pseudomyretemediaris were the ones that often came up, but really you could include any other antibiotic resistant pathogens that are important. Next on the list, we actually lumped the gastrointestinal. So although salmonellosis was number 3, E. coli and Campylobacter weren't far down on the list. And so it was thought, since they are of the same grouping, gastrointestinal, and often are tested at the same time, it'd probably be good to include all of them as one group. Next on the list was Borrelia, so the Lyme pathogen. But if you went, I didn't show it, but further down on the list within the top 20 were some of the other vector-borne diseases. So we did make that as one lumped pathogen group as well. And although we didn't include it, Leptospira would be one of the next ones on the list for us to consider. If we looked based on province, things did jiggle in terms of which was sort of on the top of the list, but ultimately those top 3 to 5 pathogens or pathogen groups were pretty similar across the 3 prairie provinces. In this, the initial funding was not including BC, but we certainly know that some of these pathogens are of importance in BC as well. And if we looked from an expert group, we found something fairly similar, that it didn't make much difference if you were public health versus veterinary from an occupational perspective. And it didn't matter much if you were government, academia, or private practitioner. Seemed to follow a similar pattern. So based on this, we decided to do some pre-surveys of veterinary practitioners themselves to identify, have they been diagnosing these, as well as, what were they using for diagnostics? Were they using any preventative measures against these pathogens in their practices, and so on. So these pre-planning surveys, we asked got about 60 respondents. So these were practicing veterinarians across the prairie provinces, Alberta, Saskatchewan, and Manitoba. And we asked, so in the last 5 years, have you diagnosed at least one case of any of the specific pathogens? Certainly Echinococcus, the vast majority of those that responded yes were from Alberta, but some were also from Manitoba. Borrelia, again, about 40% of respondents said yes, they had diagnosed in the last 5 years. And most of those were from Manitoba, although there were some also from Saskatchewan and Alberta. And interesting to me was some of the other vector-borne pathogens that were on that list. Ehrlichia and Anaplasma were up there at about the same percentage as Lyme pathogens. So we talk a lot about Lyme, but we tend to not focus much on the other ones. And that may be because we're just not getting reports of those being identified. And we'll talk a little bit more about why that is in a minute. So we certainly can see that there is evidence that veterinarians are reporting these pathogens, they're diagnosing them, and they're having to deal with them on an animal health perspective. And certainly all of them would have some implications from a public health perspective. Now, just because Echinococcus, for example, there was no respondents in our survey that said, yes, they had diagnosed Echinococcus in the past 5 years, it doesn't mean that that pathogen does not exist in the province. We certainly know from other evidence that, yes, Echinococcus does exist, both alveolar and actually hydatid. For example, we have it's probably a little older now, but we had a occurrence of the hydatid cyst in a person in an Indigenous community in Saskatchewan, and that was followed up with some looks in terms of what was existing in the dog population and how was it potentially cycling within the community. So we do know that it does occur here. One thing to note is that Echinococcus can be dealt with if dogs are given dewormers, and that does decrease the risk. So you're probably seeing this again in those areas where there might be reduced access to or utilization of veterinary services and the use of dewormers. Certainly something to think about. So we did, in the end, come up with some definitions of what we wanted to be able to follow using our surveillance. These are confirmed case definitions. If you don't use a confirmed definition, for example, in the enteric pathogens, all you're looking then at is a syndromic surveillance of GI conditions. Certainly can be done, but we wanted to focus more in this on actual specific pathogens of interest. So also important to note for the top 3, which I've highlighted in blue, these do require confirmation using a commercial laboratory testing. Certainly for our helminth pathogens, we can do fecal flotations in clinics, which will tell us that there might be tapeworms, but it won't tell us what kind. and that requires testing at a laboratory. Enteric pathogens, we just don't have the capacity within a private veterinary practice to grow and do the bacterial isolation. So that gets sent to a laboratory. And there actually are GI panels. And so if someone has an individual dog, they may send for a full panel, which will give them all 3 pathogens. Bottom of the list, Lyme disease. That one actually, as with the other vector-borne diseases of Ehrlichia, Anaplasma, and heartworm or Dirofilaria. These can be done in an in-clinic test. So it's the SNAP 40X test. And that, if it's done in clinic, that doesn't get reported anywhere. So there are certain pathogens that if it's done on a commercial laboratory perspective, that might get reported. So the Lyme pathogens, for example, if that's done through IDEXX or an Antec laboratories, that can get actually reported to something called the Canine Animal Parasite Council. And you can go to their website and see some of the information that's posted there. But not every province uses those laboratories for this testing. And the vast majority are actually 70% of vet clinics are using in-clinic testing. And so that information is not being reported to anybody. So certainly these diseases we looked at it from the perspective it could be any urban, rural, or free-roaming dog. But because we are going to be using veterinary clinics, the likelihood of seeing the dog in the veterinary clinic probably makes it more likely it's urban or a rural dog. So the enrollment phase, we did ask questions about, how often would veterinarians be willing to enter data? Where would they be willing to enter data? And in the end, it really came up that probably veterinary clinics would be willing to log into a site and upload some information on a quarterly basis. We were hoping to do this for sort of a 2-year time period to gain a baseline of data. Through an academia institution, we had to do ethics, which did put some limitations on how we could sort of do this. And one of those was to basically have the survey in a login site in order for them to access that. So the platform that we are working through is the Western Canadian Animal Health Network. This was a recently designed network of networks similar to the Ontario Animal Health Network. And it was basically designed for a number of the livestock industries, but we were able to coordinate with them to include the companion animal surveillance initiative, at least initially in our enrollment phase and our baseline phase, and we'll see how that goes from there. We do ask the veterinarians to just give us a little bit of demographic information, but after that point, they can voluntarily log in every 3 months to upload information for that quarter. We additionally have some money set aside for targeted investigations if there's unusual conditions, new places where a disease is being identified, or just a need to look into further about a specific disease entry. We could do that based on having that money available to us. So that was sort of the planning phase. The framework was in place, but one of the things we wanted to be able to assess also was what would be the representativeness of the system. And so for that, we need to know where the dogs were located. And so for that, we set up a population-based telephone survey. We started with Manitoba, Alberta, Saskatchewan, but we are presently also doing BC. And so we had about 3,000 households in the prairie provinces. We asked them about, do you have a dog? How many dogs? A whole bunch of questions. And from that, actually get sort of insight into how many dogs and in which regions these dogs live. So I can report sort of some initial pieces from that. We were able to estimate the actual population of dogs that might exist in the different regions. The regions we used were based on postal code because that was easy enough to ask the individuals on the phone, you know, what's the first 3 digits of your postal code? And map that out. And so certainly dogs are where people are. And so it does mirror quite a lot in terms of population size on a human perspective. You'll find similar in terms of a dog perspective. We did get responses from just about all the FSAs, which was nice. Did miss a few, but we're able to then, in further steps, extrapolate and estimate what might be there as well. So for the prairie provinces specifically, we estimate about 1.4 million dogs. We do have areas that are largely covered by veterinary practices. So that's the little black dots. Each one of those is a practice that will see canines specifically. So those could be mixed animal, so companion animal and large animal, or just companion animal practices. And certainly from that, you'll see that northern Saskatchewan and northern Manitoba do not have established practices. But we can also utilize sort of some of the not-for-profit groups that are going into these regions and providing veterinary services. We can tap into some of their information as well. So just because there's no veterinary practice doesn't mean those animals wouldn't necessarily be part of the system. I certainly think it gives us an indication that our surveillance will be representative of where the dogs exist. So I'd like to just give a little update. We are in the enrollment phase of the Western Canadian Companion Animal Health Surveillance Initiative. It is open to veterinarians and veterinary clinics from Manitoba, Saskatchewan, Alberta, and British Columbia. It can be just companion animal as long as they see dogs. So if they're a cat-only clinic or an exotics clinic at present, they won't be part of the surveillance initiative themselves, but you know, in the future, we might be able to expand this to include diseases of cats as well. We ask for quarterly surveys and we have a list of specific pathogens. We've included some dog-specific pathogens, so parvovirus, canine distemper virus. We've also included Brucella canis. From an import perspective, that's one that keeps coming up for us. Doesn't happen very often, but it is one that certainly we need to keep track of. Certainly a lot of interest. We have a lot of veterinarians who realize the importance of it, but COVID, the pandemic, and sort of some of the implications that have come out from an obvious veterinary shortage. I've read that in the news. These are certainly hampering our veterinarians having time to be able to fulfill being involved, participating in the initiative. I certainly, every time I talk to veterinarians, so this past weekend, did talk to a number and they said, oh yeah, I love that. That's a wonderful system. We'll be involved. But certainly it just falls to the bottom of the list often when you get back to work and you feel overworked and burnt out. So we certainly are seeing some challenges in terms of the enrollment phase. Which brings up, you know, if you are having issues, does that mean that you need to change the system? Not necessarily, but we are certainly exploring if we need to redesign, if we need to maybe do some things different in the enrollment. Certainly ethics has, I will say academic ethics are not necessarily designed for ongoing surveillance initiatives. And that's probably a reason why most of them are done from a government perspective. You kind of get around some certain things. I know the Ontario Animal Health Network, they email a link to all of their veterinarians every 3 months as a great reminder. My ethics did not allow that. I can't do group emails, can't use sort of email group email platforms in any way, so we had to do it through a login system, and that certainly does create a barrier for participation. So some of the ideas that might need to be explored in the future, certainly this is a voluntary system, but maybe there's a need for some mandatory reporting. We have that for individual disease pathogens in certain provinces. So for example, Lyme disease is reportable in Saskatchewan. Salmonellosis is notifiable in Alberta, but that is not equivalent across all the provinces. So perhaps a conversation about creating something that's across all provinces would be useful. We could look at extracting laboratory data. Certainly, since 3 of the pathogen groups do require confirmation from a commercial laboratory, that could be a useful way to go. Biggest issue we have right now of the 5 major laboratories across Western Canada, only one of them that I've talked to is able to actually extract the data easily that we're looking for. The other ones say they'd love to, but they don't have the mechanism to extract the data at this time. That is not new. Certainly when I was a graduate student many, many years ago, that same conversation was going at that time. So it's certainly something we haven't resolved from a companion animal perspective anyway. And the other option might be to work with corporate practices. And the last piece I'd like to talk about is sort of the usefulness piece. So we were working with a Canadian field epidemiology trainee that I was co-sponsoring. And we had hoped to be able to sort of use data that we collected from the surveillance and see how people would view it in terms of its usefulness. But since we're still in the enrollment phase, we did this in an alternate mechanism, just to basically still be able to determine whether it would be useful or not, just not using actual data. So from this, again, it was a little hampered because of COVID and our public health system being quite busy and needing a bit of a break at the end. But we were able to get 8 key informant interviews completed. We were focused in on participants that were particularly using surveillance of tick-borne diseases or pathogens, but could expand it to others as well. But this seemed to be the most realistic to start with. And from this, we did ask a number of questions, sort of what kind of data would you like collected, pie in the sky thinking, but also, what might be useful for them and the likelihood that they would actually use. How would they like that information disseminated? How often? What format? But particular interest was, how might this be useful from a public health perspective? And so some of the things that came back were certainly an indication that yes, dogs can be a good source of ticks and tick-related information. That's already existing. So ticks that are found on dogs are reported into the system either using eTick or submissions in certain provinces. And that information then is collectively assessed with tick information from humans and other species. But other than that, they did identify some other ways in which it might be useful, sort of contributing where data isn't regularly collected or reported. For some diseases, this might be, in a rural area or in an area that does not have veterinary clinics or sort of an already established reporting system on that side. Might guide active surveillance. So if there's an area identified from a dog perspective, maybe that then needs some information from a human perspective. All these different ways in which they thought it might be useful. Contributing to communications, certainly that is one that does happen already, but maybe it can be augmented by saying, we also have had dog cases in these regions. So certainly we did see from the responses from these individuals that they certainly used the system, they used tick information, and they would likely use dog-related information as well. So I think that sort of comes to the end of the stuff I'd like to present to you. Certainly open to answering any questions that you might have about the system, the way that we developed it, or any other questions that you might have.
Thank you so much for your presentation, Dr. Epp.
Sure.
At this point, if anyone has any questions, please submit them using the Q&A function. And as we wait, I will ask some questions. How would you like to build upon or expand this surveillance initiative going forward and into the future?
Oh, it's a hard question to answer. You know, I'm kind of in the process of how do I get veterinarians to really engage in this? And so a lot of what I've gone back to is really just one-on-one communications with veterinarians. We have created it now. We've tweaked a few things, and essentially we've made it so although the veterinarians have to sort of keep track of what they diagnose in a 3-month period, they can have a staff member go into the system and upload it. So it makes it a little easier. Maybe this, you know, the front secretary has a little more time to do this. It takes about 5 minutes. I mean, some of the pathogens we're asking about, they probably are not going to have seen them. So that makes it very easy. So certainly that, I think there could be some important pathogens that we might need to add to the list. Certainly I've been asked as well, you know, can we add cats to this? Can we add exotic pets? And so the answer, you know, absolutely in the future, they're certainly open. It'd be easy to follow the similar process and figure out, are there pathogens from a cat perspective that we need to add that, you know, we haven't covered from a dog perspective. So that's certainly there.
Right, yeah.
I guess the sky is open, but I'm trying to keep my mind on how do we get this first part really going forward. Yeah.
Of course, yeah. So we do have one question coming in from the Q&A chat box, which we will answer live now. The attendee asks, how do you anticipate using the information that you might identify through your surveillance efforts showing an increase in a particular pathogen?
Absolutely. So we have opportunities to provide information back to the animal health practitioners for sure. I know the Ontario Animal Health Network does theirs similar. We were hoping to follow a similar, and that is create summary reports on a quarterly basis as well on an annual basis. Those can be uploaded to our WeCan site, so the Western Canadian Animal Health Network. There's a public face where it can be provided, which anyone can access, but also we could provide things just specifically to the animal health individuals, and that would go into the login pages. So that's sharing the information back to the animal health perspective. But essentially from a public health perspective, you know, certainly they could access it through the WeCan site, but we can also set up and be able to send it to individual stakeholders that are interested. They could get those summaries. Now, when we asked from a usefulness perspective, the answer was a bit divided, and a lot of people said, oh, just once a year is fine. And others said, well, could we get it, you know, as it comes through? And so that certainly, we would get it on a 3-month basis. So that certainly could be quarterly reports for those that are interested, or annual reports for those who are not interested. Additionally, certainly what happens now for some of the pathogens, they get reported to veterinarians themselves if it's a reportable disease from a ministry perspective. So in Saskatchewan, for example, if something comes up that's important, they will put out an e-link that goes to all veterinarians. we could provide something similar if that was sort of wanted. It's really open for, you know, what people need, what people want, but not overwhelming them in the system. And that's always that fine line between how much is too much, where you're kind of crying wolf and nobody listens anymore, versus what's actually useful.
Right, right. It's striking that balance. We do have another question here. Have you considered using a crowdsourced approach with the public to complement your lab-confirmed surveillance, similar to Flu Watch, for reporting on symptoms that pets might be experiencing on a weekly basis?
Very good questions. Yes, and I did a webinar for more the animal health side a number of months ago, and this was brought up as, you know, could we use public sourced data? And I think it's definitely possible. We could actually also use similar, right? Look at what people are web browsing. Are they looking for information on dogs and specific pathogens, right? So there are ways to include that information. The interesting comments that I got from more the government side of things was, yes, but it's not really information that we would want to stake our hats on. And so I think, you know, it probably is one of those where it could be a useful way of assessing, are you capturing things? But whether or not it would be used in decision-making is a whole nother piece of something to consider. Some people might be open to it, others, it probably would be downgraded in terms of the relevance of that information.
Right. Okay, thank you. One more question coming in here. Rather than duplicating efforts regionally, is the plan to expand this to a national surveillance effort?
Interestingly, no. So I've taken on the Western Canadian. Ontario has their surveillance. Quebec, Razio has created their own system. In fact, I think they might actually be moving more towards the electronic data capture, still in the early terms. And Atlantic Canada has their own system as well. So we have these regional blocks. We do all collectively have an overarching Canadian system. So it's the Canadian Animal Health Surveillance System, CASI. And we have a companion animal network that gets together probably 3, maybe 4 times a year. And we discuss issues that have come up in terms of each of our regions, things that we'd like to work towards as a group. And one of the conversations in that is, how do we get laboratories to be more communicative across, or providing information, extractability, and that sort of thing. So certainly we have these conversations, but the surveillance systems are set up on a regional basis.
Okay, interesting. Thank you. There's about 5 to 8 more minutes for questions. So we'll take a moment to give those who are currently typing a chance to submit their questions. I will ask another one in that case. What do you anticipate future challenges of this work to be as you move from enrollment?
I think, like all surveillance, it's the continued participation will probably be one of the ones. And I would say that because Ontario Animal Health, that's one of the elements that they deal with on a quarterly basis. I've been told that they have, you know, probably hundreds of veterinarians that have enrolled and engaged. They get sent the survey every 3 months. And less than 10% of them actually contribute each quarter. So it does give a snapshot, but it's certainly not all the veterinarians that are enrolled that are. And so it's that continued, right, capturing their attention, making sure that does get entered. I always, marvel at the public health agency's voluntary system where physicians report specific diseases. We're hoping to sort of garner that interest in our companion animals a little bit more. I think, it's been long-standing in our large animal practitioners, but our small animal practitioners have not really had to engage with that yet. So it's getting them used to the concept that, you know, if I see something, someone else might actually benefit if they knew about that.
Right. Yes. Yeah. One last question here. Just wondering, have you considered or are you able to use the surveillance to test or detect monkeypox or COVID?
So COVID's always an interesting one because from the beginning of the pandemic, really from a federal and a provincial perspective, the advice for veterinarians has please don't test. We don't want to overwhelm a system that's already being used for other stuff. And really it wasn't going to help from an animal health perspective since the diseases weren't of large importance to animals. And so that mandate is still kind of in place. You know, if you don't have to test, don't test for COVID. Probably not, although, you know, if that needed to change, certainly it could, but right now we are a bit restricted with that. Monkeypox, I suppose we probably could. That one didn't actually come up on the list of a disease that's ever been identified in a dog. So I'd have to go and look and see, you know, what are the likelihood that we'd actually be able to diagnose or even find it as a pathogen. It could be because no one's ever looked, but that's not necessarily true. So,
right. Thank you. Are companion animals visiting veterinary clinics in families with higher income? And does that influence what we see in the surveillance results?
You know, it's certainly something to consider. This surveillance based on veterinary clinics will be for only those dogs that visit a veterinary service. In the telephone-based survey that we did for our pet atlas, we did ask the question. So for every individual that reported having at least one dog in their household, we did ask the question of whether they've visited their vet in the past 3 years, because some people are on a 3-year cycle for vaccines, other people it's every year, so it just depends on the system that you have. And actually, I was kind of surprised, but about 95% of people said they used a vet at least once in the last 3 years. So I think there's a high percentage of people who have dogs utilize that service. It was a bit less if you went rural versus urban. So potentially we could get a little more representation in urban areas. But again, dogs are where people are. And if you have a dog that has a clinical condition, they're more likely to see a veterinarian. And some of these conditions may be more likely to cause some severe disease in dogs. Some of our pathogens might be less likely. So yeah, we do have the chance that we could miss things. And that's, I think, with every surveillance system, right? Their ability to find a pathogen when it's there. You hope that it's high, but there's always things that you'll miss. Yeah. Right. And so certainly maybe more urban, maybe more, they're more likely to take their pet to see a vet. Those are the ones we're going to see.
Yeah. We have another question here. On the long term, what is the impact of the surveillance system for travelers with pets?
If you're traveling around Canada, we have no regulations in terms of what your dog needs to have, what it can't have. Within Canada, everyone's free to travel. If you're traveling to another country, there are certain requirements depending on where you go, but they are sometimes pretty minimal. If you are importing a dog, that's certainly going to change in the next 2 weeks. But if you are importing a dog from a personal perspective, you're a lot freer than if you're on a commercial perspective. So our commercial imports of dogs, we certainly have upped the ante on that one. So you have to have a permit, and now as of the 28th of September, dogs will not come from rabies endemic regions. So there's a list of, I think, 135 countries that get dropped off the import list as of the 28th of September. But we really don't have any other requirements for looking for diseases in dogs. And that's something on a veterinary perspective we are talking about now. because we've imported brucella, we've imported canine influenza, we have imported a number of diseases with dogs, so maybe we need to rethink that. But on a traveling perspective within Canada, there are no regulations. You're free to travel.
Yeah, interesting, very interesting. And I think oh no, we have one more question. Last question. Oh, this is a question, I think, for my background. The map behind me. Yes, just places that have been visited. Thank you. And with that, I want to thank you, Dr. Epp, for your presentation. If anyone has any questions for Dr. Epp beyond the presentation, you can email me. I'll put my email in the box and I will get you connected with Dr. Epp. And as a quick reminder, please fill out the 5-minute survey, which will pop up once you close your browser. And thank you so much for coming in, and have a wonderful afternoon and stay safe.
Thank you.